Thanks for staying tuned. It's still the conversation here on Lagos Television. And like I said before we took that break, we're taking a look at a very, very vital discussion today. Though it is women related, but it is one thing that, you know, everyone will learn from, because of course brothers, fathers, husbands are also part of those that should know about this particular issue, so you can be support systems, you can help out when these issues occur. Today on the program, we're taking a look at endometriosis, early diagnosis and management of this condition. Of course, our doctor will tell us today, is this condition curable? Is it something that, you know, one can outgrow, or how exactly do we deal with this particular situation? I have a faint idea of what this is because I'm not a medical doctor. So our doctor today will tell us what this is all about and how early detection remains vital and very key. Join us this morning as we welcome into the studio Dr. Haleemah Olalere. She is a senior lecturer and consultant obstetrician and gynecologist. Thank you for being here on the program this morning, Doctor.
Thanks for having me.
Right, endometriosis. In layman terms, what exactly is this?
Oh yeah, endometriosis is a condition in which we find the endometrial lining. What I mean by endometrial lining? The womb of a woman has different forms. We have the outer part of it, which we call the serosal layer. We have the muscular part of it, and we have the one that is inside where the baby lies.
Okay.
So that's what we call endometrium. So when we now find the tissues of this endometrium, or the gland that is secreted there, when we find it anywhere outside this lumen, it can be found in the ovary, it can be found outside, it can be found in some people's brain, it can be found in some people's chest. So we call that endometriosis.
That means it is not placed where it should be.
Yeah, it is an ectopic in where it is found.
Right. I know, Jibola. Jibola, don't worry. I already told you. Today, you will be a support system. You will be a support system.
Doctor, please, I have one question. Why is it described as a silent killer?
Thank you. It is not a cancer, but it behaves like one.
Okay.
Why I say it's not a cancer, it's like a benign disease. So the diagnosis of it, if it is not in the right hand, it may take time. Okay. Like some people, like I said, it can be found in the brain. The endometrial tissue found in the brain. The patient may be present by having seizures, convulsion.
Okay.
Every time she's menstruating, she's having convulsion. So nobody will be thinking of it being an endometriosis. Or someone that is coughing and bringing out blood. Anytime she's menstruating, because that tissue is the one that is shedding in the endometrium when we say menstruation is taking place.
Okay.
So when the person is menstruating, the tissue is bleeding in that place. It's also bleeding in the brain. It's also bleeding in the chest. It's also bleeding in the ovary of the person that is involved. So silently, if it is not in the hand of the gynecologist that knows that, when something is cyclical, and is related, your timing of it is related to when your menses is coming. So they may not know, they may be treating another thing. So that's what they call it, a silent killer. The person is actually dying and is not actually getting the help that is required.
So meaning that this particular condition is tied with the menstrual cycle of a woman, or is there any other way that it presents itself in a woman?
Yeah. In some women, yes, let me say yes to the first question. That's tied with the menstrual cycle.
Okay.
That's what's given that. And in some women, it may just be asymptomatic. The only thing that where it is peaked is probably they're looking for fruits of the womb in the fertility issue. So the case is found in about 25% of women asymptomatic.
No symptoms at
no
all.
symptoms at all. It's only when they come for the fertility care, that okay, the child is not, the pregnancy is not
It's not
forthcoming.
coming.
That's when it is detected.
Oh, wow.
Okay, and in some people, it's just okay. They feel that they have fibroid, and during the course, I mean, after they removing the fibroid, that's where they realize that, oh, there are some endometriotic tissues here. I've seen in quite a number of even young girls that just realize that their pregnancy is not forthcoming. I happen to do IVF, so in the course of doing the IVF, you started the IVF for her, and you do the scan and say, oh, this endometriosis is around the corner here. So some people may just not be no symptoms. And some people, the symptoms they just have is like adolescents, young ladies that just started menstruating. They just realize that, okay, she started menstruations very early, and between 27 days, less than 27 days, used to be frequent menstrual cycle. And some women that they don't even, at the age of 18, 16, she has not started menstruating at all. But every month you realize that this child is always having severe pain. Okay. So there's some pathology that they call that the people that the outflow tracts, that the vagina is not opened at birth. So the menstruation that is happening here, menstruation that's happening here, is not getting an outflow tract to come out. So after accumulating, the menstrual blood that's supposed to flow out, it accumulates there
somewhere. Wow.
Inside the womb. So after sometime it's tracked out through the, this is the womb. It has a hand. What I mean by the hand, the fallopian tubes. Okay. So when it's accumulated air, there is no outflow tract air. So it's retrograde menstruation, we call it. So that thing will shed back from the fallopian tube back into the peritoneum, and because it's severe pain. When you have a young lady, teenager, that is always having pain,
that's the signal. You must get that checked.
You have to get the checked that something is going on there.
So when your period is unusually painful or the flow is heavy, that's a flag.
It's a red flag.
But is that usually, I mean, so a red flag, in most cases, would that be endometriosis? Because some people have painful menstrual pain, and at the end of the day, may not be diagnosed with endometriosis.
Yes, and let me say something about that. We call this disease of dysmenorrhea. DYS. DYS meaning that dysmenorrhea, painful when they're during the menses. Dyspareunia, when they're having sexual intercourse, you see some people, the couple, they're just fighting every time. What's actually the cause of the fight? Because
the pains.
The pains. The woman is having pain after the penetration. So every time she's in pain because of the endometriotic nodules that is there. When the woman is having sex, the male organ is eating on the cervix. And when it's eating this other, the uterus is eating the peritoneum where the thing
So
does.
there's
usually painful. And dyspareunia, okay, painful sex, dysmenorrhea. This case there, some people when they have it in the rectum, when they are passing fecal matter, they are actually having pain.
Wow.
Some are having it in bladder. When they are passing urine, they are seeing blood and they're having pain.
Wow.
So it's everything around this is pain.
There's a problem. Wow. Okay, let's go back to early detection, because usually we always say that early detection is key. So for parents who have teenage daughters, what should you look out for? I know you've mentioned that perhaps you have a late period, or during your cycle you have painful cycle. But as parents or as mothers, generally, what are the questions that you need to ask your daughters? Especially at what age should you start being on the lookout for some of those things?
Thank you, ma'am. It's usually after the second decade. Second decade, maybe like 25 in the reproductive age group. However, we still find it in some adolescents. After menarche means the age at the first menses. If the child started menstruating, let's say by the age of 12 years, in some people, within 12 years into the menstruations, they started having these painful menses. If you have the child that is, sometimes in, let me say, Yoruba land, we believe that if some child is complain that I'm having pain, I'm having this, I feel like, oh, she's just being lazy, she doesn't want to walk. Are you the first person that's going to menstruate? I also have done it before. But get up and come do this thing for me. So we should try and listen to our children to know when they are in pain. Let us know. Then when the child is having the prolonged menstrual period, ideally it should be within 2 to 7 days. If the menstruation starts, it should have ended by that time.
Okay,
so
2 to 7 days
averagely. So by the time you have a child that is having this menstruation, 8 days, 10 days, my mommy, you know, Muslims they don't do salat during menses, and you say rest that. Hello, are you not going to pray? Mommy, I'm off salat. How many days? So I started 2 weeks ago. On top what? So anything that the menses is getting prolonged beyond 7 days, we need to just pay a close look at it.
Okay.
Okay. I also want to find out if this is genetic, and Abimbola did say the other time that it is not curable. If it is not curable, what are the treatments available?
Okay. Thank you, sir. I wouldn't say it's not genetic. Okay. But we can't actually, there are some genes that has been shown to be associated with it. Okay, so if I don't want to bore you with all these medical jargons, we have WNT force genes, we have estrogen receptor genes, and the like. But it's not only genes that is actually. It's also it's links with environmental factors, hormonal factors. Okay, so. The genes that if the gene is detected, so that one could be something like a link that could help in the getting a diagnostic test in future. But as at the moment, there is no really diagnostic test that has related to genetic factors. However, if the mother has it, or the sister have it, or the aunt have it, there's a red flag that it is actually the family. That's the child that is actually complaining of the pain. When menses can equally have it. So why do we say early detections can actually help? Is that okay? You know, when this thing is happening, we said as the client or as the woman, this young woman is menstruating, she's equally bleeding into the ovary or bleeding to other organs where that has been transported to or implanted to or where it is found. So the accumulation of this blood in this site will resulted in scarring, adhesion formations, and in the ovary, it's actually reduced the quality of the ovary, and that's predisposed the young woman. We are finding the young woman 27, 30, and coming for fertility care, realizing that the ovarian reserve is gone
at that age.
So that's why early detections will have done a better things for that kind of a woman before the ovarian reserve is gone.
Right.
So what about the treatment?
So
the treatment that are available?
The treatment options, we have the medical, we have the surgical, we have the life support, lifestyle modifications, but the actual treatment depends on the presentation of the patient.
Okay, so it's not a one-size-fits-all.
It's not one-size-fits-all. Depends on the age of the patient, depends on the severity of the disease, and it depends on does the treatment that the person has had before, does it work for that person?
Okay.
And also, it's also depend on, is this person still looking for pregnancy?
Okay.
Okay, so, but basically, the aim of the treatment is to improve the lifestyle of the patient. Okay. So relieve the pain that the patient is having, they can be given different analgesic.
Right.
Okay, the different analgesic. So if the person that presents with abnormal bleeding, we call the excessive bleeding, we call it menorrhagia in our jargons. So if the patient that has a menorrhagia, we have to be placed on some hormonal drugs.
Okay.
So we have the hormonal, the oral, we have the injectable, we have the implants, and we have the intrauterine contraceptive for some people.
Okay.
But the aim of all these hormonal is to make the patient has a forced pregnancy state or forced menopause state, because the the hormones in the body that usually supports the endometriosis itself is estrogen. So what they want to do at that time is to silence the estrogen and to make the progesterone higher on the higher side.
I have a question, but let's quickly take Joy's contribution to this conversation, and then I'll come back to my question. Joy, let's take your contribution.
Wanted to ask. So I wanted to ask, at what point is surgery a solution? Because I have seen someone who has endometriosis and she goes through so much excruciating pain. And like you said, you have some people have it in the brain, chest. So for someone who has it in the womb now, at what point do you need to, take surgery as an option? And then taking out the womb, is that a solution?
Thank you very much for that beautiful question. Like I said, the treatment is not one size fits all. Depends on the age of the patient and whether the person is still desirous. For the woman that is still looking for the fruit of the womb, that want a pregnancy, removing the womb will not be an option for that kind of a person. Okay. So the surgical aspect, maybe to diagnose, to be sure of what is actually causing that chronic pain for the patient. So one of the surgical intervention is laparoscopy. Laparoscopy is a minimal access surgery. You don't need to cut the woman open, just make a small incision and look through the peritoneum to know what exactly is going on. So in that kind of situations, when they find endometriotic nodules, so they tend to either ablate it, burn it, or remove it as much as possible. And in the situation where it is found in the ovary, that's what we call endometrioma. That is formed like a cyst. It's not a cyst per se, but it looks like a fluid cavity inside the ovary. So that kind of situation, so that's the old cyst of it is taken out. But however, if it's a woman that is not actually desirous again, or probably the person that's completed a family,
you can
why
just
not?
take out the womb.
The womb can be taken out.
So someone is asking a question here, and is it in line with what I was going to ask you earlier, that can a woman with endometriosis still give birth?
Yes.
So which means that this can unlike when you have fibroid and it's difficult to carry through it's difficult to manage that through with a pregnancy. Is that also a determinant here when you're pregnant and you have endometriosis? Are there challenges that coexist with both?
Oh yes, there is challenge that coexists with both. Like in the one that has endometrioma, the cyst that is already big on its own, the pregnancy is also big on its own. So we can say, okay, the pressure symptoms. However, those that are looking for pregnancy, there is a fertility-focused treatment for them. So some may find it difficult in getting pregnancy spontaneously, without assistance. So in that kind of a situations, they need to see their fertility experts. Okay, some people may just have to boost a bit, giving them some ovarian stimulations and ask them to do timed intercourse. Oh, at this time you're likely to ovulate. Meet your husband. Okay, some people they may need to you may need to get the husband's sperm, wash it, and do what we call intrauterine insemination. And to some we may need to do the IVF for them, so be able to achieve the pregnancy. And some is advisable that for this, please, let's do your egg freezing in case you are not actually ready. There's no spouse now, but the progression of this thing is going on, and ovarian reserve may be affected. So there may be cancel on that. So,
as much as this is a woman thing,
you cannot do it without the men at all.
Women are going through a lot from your explanation this morning. You mentioned lifestyle modification as part of the treatment the other time. So when you say a woman should modify, what are those things that a woman will need to modify? And aside from the brain and the ovary, if I'm correct, where are the other places within the body of a woman that this disease can be found? Okay,
thank you. I mentioned that some women have what we call thoracic endometriosis syndrome, that it can be found on the chest, whereby the having bled into the chest. When I mean the chest, in the chest there is a thoracic cage, the bone of the chest. There is a lungs that we have to breathe in, breathe out to it, and there's a heart in the middle. So they can be bleeding into that cage. Okay, so bleeding into it can result into the lung collapse. Okay, so some people, they may be bleeding into the lung tissue itself, that when they are coughing out during the menses, they will be coughing. So when they are coughing out blood. Okay, so some people, apart from the chest, they may have it in the ovary that I said, bleeding into the ovary, and that's after accumulation to become a big cyst in the ovary. You know, this you could see this ovary is the ovary is attached by just a support to the side of the womb. So if the ovary of a woman is just around 2 centimeter by 3 centimeter, and she has a cyst that bled into it that is as big as 10 centimeter, you know, it's going to
weigh it down.
Right. Remember this the pendulum clock. So when it is moving like that, too heavy, the weight is heavier for the support, so it may twist on that support. So when it twists, the blood supply to the ovary, we see is that the patient come down with acute abdomen, severe pain that may necessitate that going for surgery to go and untwist that.
Doctor, what are some of the cultural biases or religious biases that we have in the treatment of or the diagnosis of this issue in the first place? While speaking earlier, you mentioned that, you know, sometimes as mothers, we could think that, you know, our daughters are pretending because they don't want to carry out household chores. But we've also realized that sometimes also misbelief, misconceptions, cultural biases are also some issues why people don't want to speak out, or also lack of support system is also some reason why a lot of people don't want to, or sometimes people just normalize pain and just say, well, it's that time of the month, it will go, I will be fine. So what do we need to start doing to ensure that once a pain is unbearable, or even if the people in your family do not believe you, how do you speak out when you have such issues?
Thank you, ma'am. So with that advocacy, education, and support groups is essential. This is what we are doing now. It's one of the education and advocacy. So people that view this may tell their friends, the family. If the man that view it will tell his friends, the wives. They understand their wives, they understand their children, they understand their sister, that she's not being lazy. So we have the both local and international support groups for endometriosis. One of the support group is the endometriosis support group in Nigeria, and we have the Pan-African support group of endometriosis, which their major aim is for those education. And aside that, we have the surgeons that are taking care of this patient. Apart from being the gynecologist, we have some special group, Association of Gyne Endoscopic Surgeons, that are the ones that do this spinal minimal access surgery. That's within that group, they have endoscopy. I mean, they have the endometriosis advocacy group specially. That what they do is they do more research into this endometriosis, and the conference, even if there are conferences that they do, share their experience, share their research findings among the others, and encourage.
Do we have more women speaking out now, seeking help on this particular issue?
Thank you. We used to think that it is commoner in the Asians, Caucasians, that it is not the disease of the black. So they realize that even the prevalence among the black is on the rise, because people are actually speaking out. You know, this area of social media has done a lot to make people speak out. And when people say, oh, I felt this is what I felt, this is what I do, I went to this place, I went to this, there's a lot of people try to seek help and know what and where to find the help. Then especially the fertility. You know, a lot of women were just there because of the taboo, the stigma of not being able to have a child
Right.
for long, not knowing that it's just that thing that is giving the pain is the one that is causing them not to be having the child.
Okay.
Okay, I know that women go through a lot, especially within their body. So as men, oftentimes we hardly understand what a particular woman is going through, not being able to conceive or get pregnant. So what kind of support can we give to our women at home, or as brothers, or as fathers who are going through this?
Thank you. The first support you need to give to them is to understand them, that they are going through a lot, which I actually appreciate you for that. That yes, you agree that the women are going through a lot. And then we provide them with access to the care that they needed. And also, apart from the medical support, they encourage them to have a regular exercise, warm bath, the dietary changes is also important. You know, women, we love something that is sugary, something that is sweet. But if you support and they say you should not take that, okay, then there are medications such as omega-3 fatty acid, or the fishes, most of our fish, sardine, titus, catfish, they are rich in omega-3 fatty acid that is actually, it improves the lives of the women that has that. Then fibers, grains, such as brown rice, guinea corns, and the like, they also help in improving the lifestyle of women that are going through that. And the stress management, okay, we can't say we can't take away stress, but we can manage it.
Right.
Okay, we try to encourage our women, to support them. And although we understand the men will have gone to work, women to go to work.
Women to work.
Go to work. So if there's any little help that we could do to lift that burden off them, try as much as possible.
Or limit their stress.
Or limit their stress level. We could do it together. Okay.
So from what you said now, I'd like for you to also speak to the conscience of employees. So that those times during those months that those women present with these issues, again, coming to the issue of speaking out and making your conditions known, we love hush-hush. We don't want people to know what we're going through. But then if you're going through something that needs perhaps also your employer to give you minimal workload or take the stress off you, how important is it to open up on your history so that you can receive help? Because it is what you know that you can deal with. So talking about employers of labor and women who are dealing with this particular situation, those times of the month, what kind of support do they need at their workplaces?
Yeah, thank you very much. The employer of labor knows that, needs to understand that, okay, this time of the period, the woman is going through a lot. And there are medications that the women that know that, okay, this is what I go through. There are medications that they can take to ease the burden. Okay, some women will have been having the pain some days before the menses, and
so you can prepare towards.
So you can also prepare towards it. So it won't be nice and fair on the employers of labor when the woman is taking that one to be lazy around, so that I know that you know that I will have pain definitely now, so I will not come to work. And when somebody is saying, I swear my message will soon start, I won't come to work again.
That one is
unfair on the employer of labor too. But the employer of labor needs to be aware that something that's around the corner. But the woman too has to please start using those medications.
It's give and take.
It's a win-win situation.
Okay.
So if the woman prepare her head that this thing will soon come, we have different apps that track the menstrual cycle.
True.
So the person will have tracked that my menses will soon come. So take some medications ahead so that through the period, even your own life
will be easy. Will be easy for you.
Irrespective of the load of the work you want to do, but I think your own life is important.
Right.
So it's not easy to go through pain. Then the employers need to know that both the emotional and mental support is actually essential. Right. So it's a person that is actually with good frame of mind that can have improve the productivity to the work. So it is a win-win thing.
Right. Okay, I don't know if my question is going to sound funny. For those women who are already within the range of menopause, are they immune from this?
Yeah. that question is not funny, quite all right. Some women that are doing with this pain throughout the life, so they are always looking towards menopause. That, oh,
finally,
menopause, finally, the burden is over.
Right.
Okay, because like I said, that the hormones that has been attributed to it is estrogen, and by the time menopause is taken, it's getting closer.
Right.
The
You
hormones
start shedding, so you're not menstruating,
and the woman is not menstruating again as usual. So menopause is a good
way out.
It's a good way out.
It's a good way
So
out.
that's why I said, what's the treatment, the medical treatment that we're giving is to give the woman the first menopause, to make them have the sense of menopause. Menopause meaning they are not menstruating.
Right.
Okay.
So I know I said something at the beginning, but let's quickly also clear the air on this management and cure. Is this curable, or is it a condition that you have to live with until at least you get to that menopausal stage, or is it something that can be cured?
As at the moment, in this environment, no cure.
No cure.
So as we speak, if I say no cure, someone may come out and say, oh, our research, these are research outcome now, we found something. But there are lots of research that is ongoing.
Okay.
So, and like I tell you, it's not a one size fits all. Depends on what the person is going through. So there's treatments to prevent the progression, and there are treatments to make to improve the quality of life. But the treatment then, if it is only found in the ovary, like endometrioma, and they did the surgery, removed all the cyst that is found there, that kind of person may not feel that pain again.
Right.
So in that kind of a person, in quotes, it may
There's
say
a
that
cure.
I got my cure.
Right.
I wasn't feeling it again. Or the person that they did laparoscopic surgery for, and they burn all those
Nodes,
endometrial
okay.
nodes, and well, guys, I wasn't feeling any pain again. So in that kind of a person may say, oh, I wasn't feeling it again. And they say, oh, if you say there's no cure, no,
There's cure.
there's cure.
So depending on...
So it depends on the severity and what the kind of person presents with.
Right. Can there be a misdiagnosis of endometriosis?
Yes,
There can be.
it's possible.
It is possible.
Because the symptoms that it presents with, there are other conditions too that can present with that symptoms. That's why I was saying that the person that the only presentation that she had is she's having seizure
During a menstrual cycle.
during her menstrual cycle. Or the person that is having cough during her menstrual cycle, that they say, why is this just your child coughing? Leave her, it's cough that she's always using to menstruate. Not knowing that it is
There
not
could be an underlying factor.
So some women might have gone to different places, from one health center to one hospital to one private hospital to one general hospital for more than 2 years before they eventually got someone that will link it that, oh, come on, is it during your menses that you have this? Is it every month? You say it's a cyclical thing. There are periods that it goes off, but every month my menses is coming. This is when I have these symptoms. That's when there's someone cannot link it together that, oh, please, it could be endometriosis. So misdiagnosis is very
key. All right, Jibala, do you have any other question? Or
No, just that I want to appeal to guys out there. Please, sometimes when you get intimate with your woman and she's complaining of pain, you need to show some understanding.
Right.
This is what they go through sometimes.
Okay. Finally, as we go, aside OB and gynaes, is there any other person any other medical practitioner who can diagnose this condition?
All doctors.
All doctors.
All doctors can diagnose. We have the nurses, endometriosis nurses that can diagnose. Well, this advocacy is for everybody to be able to know that, oh, to have the clue that presumptive diagnosis, oh, you're menstruating, you're having this thing. If you're not menstruating, you're not having this thing. Oh, could it be this? Please go and see your OBGYN.
Okay.
So everybody should be able to link anytime that the symptoms or the symptomatology of the patient or your wife, your sister, that is during the menses that she's having the issue. So let her go and see her doctors. Then another thing, these endocrine disruptors that is found in some all these plastic, the disposables, our lip
gloss,
our perfume and the like, there are some endocrine disruptors we need to just watch out.
So by
because
reading
it is
labels,
still hormone,
are they on the labels? If you read some of these labels, can you
some
find?
of them are there on the labels. Some of them are on the labels, and if there's this hormone imbalance, so most of it tends to tilt the women to having all these conditions. But they are all, as we still say, they are all the risk factors, they are all associated factors. It is not a one particular single factors that actually push the woman to endometriosis. But the red flag is, my sister has it, my mother has it. Please watch out.
Watch out for those. All right, we'll have to leave this conversation here this morning. Thank you so much, Dr. Haleemah Olalere, Senior Lecturer and Consultant, Obstetrician and Gynecologist, for giving us insight on this topic today. We appreciate your thoughts.
Thank you very much.
Of course, we've been speaking with our guest this morning, and she's taking us through all that we need to know on this particular health condition. And trust me, Ajibola, you did well. You contributed well this morning. We'll take a quick break. When the conversation returns, Joy will be here with her Lagos conversation.